Welcome to week 5. We'll be discussing cardiac, respiratory, and the lymphatic systems today. So definitely with the breast and lymph, review the structure and functions, anatomy and physiology is crucial to assessment. So make sure that you're aware of this. Think about your developmental and cultural considerations when you want to assess the breast and lymph tissue, as this can be a very awkward situation depending on your patient if you don't take this into consideration. There's subjective, remember your health history. If there's any subjective data about the breast or the axilla, have they felt any lumps or bumps or have any concerns, those definitely need to be paid attention to. Your objective data, this is definitely a teaching time as well as making sure you're prepared and have the equipment you need. Make sure the patient is comfortable and try to put them at ease because this can be very awkward for them. You're going to inspect and palpate. Think about gender differences. Even if it doesn't matter gender, they need to know how to do a breast self-exam. So there are men that have had breast cancer, so we need to do some education here as well. They may not be aware that men could also have breast cancer. Abnormal findings, definitely report those and talk to them about any or think about any abnormal findings you may have with these patients. Moving on to the thorax and lungs. Let's review the structure and function again. With the thorax and lungs, take into account the age and size of your patient. Also, cultural considerations come into this, definitely discussed in the textbook. A subjective history. Have they had any questions or concerns? Have they been coughing? Do they have any history of asthma or any other history of smoking, things like that. So your subjective data can play a big part in your assessment of the thorax and lungs. Are they a swimmer? That can be also part of it. May make some differences in your assessment. Objective data, things you need to think about. Warm your stethoscope prior to putting it on the patient. You're going to inspect, palpate, percuss, and then auscultate with the thorax and lungs, so a slightly different order than you would anticipate. Then you'll also discuss any abnormal findings. Again, looking at excursion when the patient breathes out, things like that. Definitely watch the videos that are available that are on the Evolve website for this area. The heart and neck vessels, think about how your patient, your anatomy and physiology of your patient, how your patient appears to you. This is where possibly even your assessment of hair, your assessment of the skin may play a part in your vessels and how the patient, their cardiac status and peripheral vascular system in these next two areas. So you're going to look at the neck vessels, palpate, auscultate, and inspect them. Again, the precordium, inspect, palpate, percuss, and discuss or not discuss, but be aware of any abnormal findings that you might have and what you would do with those. Peripheral vascular and lymph, again, this is part of the immune-related organs, so you need definitely the subjective history. You need to have any inspection and palpation, color changes in the skin, the hair distribution. If you do any Doppler or ultrasonic stethoscope, use any of those things to listen to the blood vessels and assess your peripheral vascular system. Also, palpating the lymph system, any lymph nodes that are enlarged or any concerns along those lines. Again, report any abnormal findings or discuss those as needed.